This video is brought to you by Straight Goods News, Canada's alternative online news source. Visit Straightgoods.ca.
Last Wednesday, Health Canada convened a conference call of national health organizations to provide information on the future of the federal tobacco control strategy and to announce that $50 million had been cut from the tobacco strategy's annual budget. There would be a scaling back of the tobacco control work plans for regulations, enforcement, and research, all core areas of work at Health Canada. The $60 million grants and contributions program would be eliminated. This program supports tobacco control initiatives by national and regional organizations to advance the key strategy objectives of youth prevention, adult cessation, as well as protection from secondhand smoke. This new budget cut is in addition to previous cuts, which have seen federal tobacco strategies funding decrease from $68 million in fiscal 2006 to $43 million last year and now to $28 million this coming year. Overall, this represents a 60% budget cut. The federal government collects $3 billion per year in tobacco tax revenue, but less than 1% of this, $28 million, will be allocated to Health Canada's tobacco strategy. Importantly, annual federal tobacco tax revenues have increased by $500 million compared to 2009 because of reduced contraband, meaning the new $15 million, 35% budget cut simply cannot be justified. We are alarmed and extremely disappointed that the government has made such a significant cut, a further 35% cut to Health Canada's highly successful tobacco control strategy. The strategy has been working, and these funding reductions will impede progress to further reduce smoking.
I'm going to be, ladies and gentlemen, brief, but I'm going to be blunt. I come here this morning with a mixture of disappointment and dismay that borders on disgust. A few minutes ago, I was in a clinic where daily I am surrounded by patients who reveal all the tragic consequences of addiction to tobacco. 5 million Canadians remain smokers. There is nothing that I can do as a clinician, nor is there anything that my colleagues in all the health disciplines can do that will be as important in terms of preventing disease and arresting established disease as helping our patients stop smoking. There is nothing that a government can do at a time when it preaches the principles of prevention and daily admonishes me as a clinician to be more preventive in my orientation. There is nothing that that government can do that makes more sense and that will have a bigger return on investment than to accelerate the rate at which Canadians are becoming non-smokers and to prevent Canadians from ever becoming smokers. It is staggering to me that at a time when we recognize that the leading cause of preventive disease, disability, and death in Canada is tobacco addiction, that our government is receding from its obligation, I would utter, its obligation to ensure that we create a community where tobacco use becomes nothing, where tobacco use, recedes almost completely. I view the recent announcement of the government's intentions in this area to be bordering not only on neglect, but also on negligence from a public health perspective. I practice in a discipline in which sanctions can be applied to those who are neglectful or negligent, and I sometimes wish that the same kinds of sanctions could be applied to public policy practitioners and politicians who make health policy, particularly when we see circumstances arise such as we are witnessing today. You will understand my indignation. My indignation is fueled by what I see daily in my clinical environment and the circumstances that I confront. The overwhelming majority of Canadian smokers do not want to be smokers, nor do they want their children to be smokers, and they would welcome the introduction in an environment in which the adoption of smoking and the persistence of smoking would be significantly discouraged or impeded. It strikes me as sadly ironic that even if we were to apply an inflationary tax increase of $2 per carton of cigarettes, that we would have more than enough resources to continue Canada's tobacco control program in its present form. I am saddened that there seems to have been a complete lack of imagination or insight on the part of those who have crafted this policy which has been released, and I would commit personally on behalf of health professionals across this country to support Minister Aglukak's determination to ensure that this reduction in our commitment to tobacco control
The federal
might be
tobacco control
reversed.
strategy was arguably the most successful health initiative ever undertaken by the federal government in terms of lives saved, disease prevented, improvements to quality of life, and cost effectiveness. The drop in smoking rates to 17% means there are 1.1 million fewer Canadian smokers. This translates into more than 500,000 averted tobacco-caused deaths. Of particular note is the fact that rates of tobacco use among youth were also cut in half during the life of the strategy. Based on an analysis commissioned by Health Canada, the federal government's investment of some $500 million over the 10 years of the strategy will yield an estimated savings of almost $10 billion in direct health care costs alone. This is close to a 20-fold return on investment. The research is unequivocal that the most effective way to reduce tobacco use is a well-funded and sustained comprehensive plan that focuses on policy change and that involves collaboration between government and non-government organizations.
Our concern is that by instituting dramatic cuts, the federal government will be unable to expand its tobacco control initiatives. Will the government have the capacity to ban flavored smokeless tobacco products that are marketed directly to our children? Does the federal government really believe that the war on tobacco is over?
So why would the Harper government gut a program that saves the lives of Canadians, saves government money, and safeguards the health and well-being of our youth? Consider who wins by this decision. The only winner, and they are big winners, is big tobacco. While the gutting of grants and contributions funding to national and regional health agencies, the Harper government has virtually assured that tobacco companies will have the upper hand in influencing policy decisions. Without health groups shining a light on the aggressive and sustained lobbying by tobacco companies and their preferential access to policymakers, the federal government would not have approved the new tobacco package warnings. This is only one example of what we can expect.
So yes, we've been successful in changing social norms, but social norms can also revert. And we've seen that with smoking in the movies. 10 years ago, you didn't see smoking on television or in the movies at all. We had won that war, and now we've seen an upsurge, and the industry again is infiltrating, trying to make smoking again commonplace and something that is part of everyday life.
The progress that we've accomplished, or the progress that has been achieved in Canada, has been, I would argue, consistently as a consequence of the pressures that have been placed on government and government agencies by non-governmental organizations. You know, as reckless and as radical as the Canadian Cancer Society, the Heart and Stroke Foundation, the Canadian Lung Association, all of these organizations who have literally been screaming over decades, government, you must do something. But governments, unfortunately, seem to be held captive very often by an industry which is reptilian in its characteristics and fueled by enormous wealth that seeks to subvert any form of public health policy that addresses tobacco issues. And that's why it's very important that there be a very vibrant, a very coherent, a very cohesive, a very forceful, and a very thoughtful non-governmental sector continuing to exert pressure on governments on this issue.
A lot of work remains to be done, and we have to be vigilant. We saw in recent years the explosion of flavored cigarillo use by young people. And now we're seeing a new threat, this flavored water pipe tobacco, hookah, or nargile, or shisha, it has different names, that's exploding across Canada. That requires a public education response, it requires a regulatory response. So we received the announcement that there's going to be a $50 million cut. The estimates indicate that for last year, the tobacco control budget, Health Canada, was $43 million. The grants and contributions program will be eliminated, and the regulatory capacity, the enforcement capacity, and the research capacity will all be reduced, all core areas of Health Canada work.